Hey guys, welcome back to my channel. Today I kind of feel sick. I'm kind of like suffering from fever, body ache and headache. So right now I'm on my way to see a doctor. Let's go.
Come in. Okay, what happened?
I'm kind of having fever and I have body ache and then I also have swollen lymph nodes. So I just came here for medicine.
You get cats at home?
Yes, I do.
I guess you're suffering from toxoplasmosis.
So doctor, what is toxoplasmosis? Can you elaborate? Toxoplasmosis and what you need to know. Toxoplasmosis is an infection that is caused by the parasite Toxoplasma gondii. The parasite is found in undercooked meat, especially venison, pork, and lamb, and can also be found in cat feces. It can also reach the human body through contaminated water. Toxoplasmosis carries serious implications, often proving fatal. It can also cause serious birth defects in fetus if a mother is affected. The parasite is quite common, believed to infect around 60 million people in the US alone. However, most people with it do not get symptoms and can live their entire lives without knowing. Let's look at the disease in detail.
Causes. Toxoplasmosis gondii is present inside contaminated meat and water. It is most commonly contracted from meat that's raw or uncooked, or by drinking contaminated water. In rare cases, the parasite can also move into the human body through blood transfusion or organ transplantation. Toxoplasmosis gondii can also exist in feces and may be present in manure you use to treat your product. Along with that, Toxoplasmosis gondii is present in all warm-blooded animals, but cats are the only known host of this parasite. The parasite sexually reproduces inside cats and its eggs move out through a cat feces. Cats do not exhibit any symptoms even though they have the parasite in them. This is why it is unadvised for pregnant women to clean out cat litters. It is fetuses and people with compromised immune system are at the greatest risk of getting toxoplasmosis.
Symptoms. Toxoplasmosis usually does not cause any symptoms to show up, and people can spend their entire lives without knowing they have the parasite in their bodies. In symptomatic cases, people are likely to experience 1. Headaches, 2. A fever, sore throat, swollen lymph nodes, usually in the neck, muscle pain, and aches. The symptoms last around a month and then disappear on their own. The condition can be quite dangerous for people with compromised or weakened immune systems, and they are likely to experience 1. A lung infection that causes fever, coughing, and shortness of breath. 2. Brain inflammation which causes seizures, confusion, and headaches, possibly leading to a coma. 3. An eye infection that causes eye pain and blurry vision. Toxoplasmosis can be life-threatening for unborn babies if they get it from their mother and cause deformities.
Diagnosis. Your doctor will take a blood sample and check for the presence of antibodies against T. gondii infection. If the antibodies indicate an infection, they will likely order further tests to find out how long you have been infected. For pregnant women, they might take some amniotic fluid to check for the presence of the parasite in the unborn baby treatment. Toxoplasmosis symptoms often disappear on their own, but in severe cases, a doctor is likely to prescribe antibiotics such as sulfadiazine and daraprim, also known as pyrimethamine. These medicines are a last resort in case of an unborn baby having toxoplasmosis, as they can have side effects.
It is quiz time.
What causes toxoplasmosis? Toxoplasma gondii. Jot down any 3 symptoms of having toxoplasmosis. Headache, fever, swollen lymph nodes.
If you got all 2 questions correct, congratulations. From Rinzin, Kumari and Karma, we are proud of you.
Let's continue with our presentation.
Toxoplasma is spread worldwide. Finding something or someone free of infection is almost like a miracle. Nevertheless, hospitals and animal hospitals are not crowded with masses suffering from toxoplasmosis. Why not? Here's the good news. Toxoplasmosis is usually symptomless. The immune system of most individuals has a good laugh at toxoplasma. People with weak immune system, especially the old, young, and those expecting, both animal and people, they become sick. Now let's have a look at the disease.
The disease. The disease in the definitive host, the cat. Infection comes about by devouring an infected intermediate host. Toxoplasma multiplies in the bowel wall and the infectious material called oocyst is emptied with the feces where it previously waits for an intermediate host to come by. In the meantime, Toxoplasma will break into the body from the bowels and scatter all over it. The cat's immune system will immediately start kicking butts, and the germ in turn will bring about microscopic sacs called cysts inside the body and go into hiding. The encased Toxoplasma marks the final stage of the disease. Generally, none of the stages causes any symptoms. This one may lead to mild diarrhea. This one in scrawny cats may cause fever, depression, sometimes more serious complaints. Single that, the vet will be able to tell with high precision that the cause of the complaints could be absolutely anything. This condition will not result in any symptoms unless the cyst is located in such unfortunate place where it can disturb the working of an organ, say inside the brain. Let's examine the intermediate host as well as using humans as an example. Humans can be infected by taking in all cysts while grazing in the meadow, but rather by eating unwashed vegetables or raw meat of the infected intermediate host. Like in cats, Toxoplasma will break into the bowel and then into the body, but no infectious agent that has oocyst will be emptied with the stool. The symptoms are about the same as in the case of cats. By the way, sometimes cats can also be infected by taking in out cyst. Mind you, quite a lot of them would be needed. Those infected will not remain so forever, just till the end of their lives. This state, however, all the lacking other advantages is bulletproof against a new infection. Well then, how can we find out if a person or an animal has toxoplasmosis? Because, as we know, the symptoms aren't really telling to say the least. Well, first of all, we have to think of the possibility. So blood test may be of help. The blood test will reveal if the patient ever came into contact with the toxoplasma or not. In the former case, it will also tell whether or not the infection is recent or old, giving a clue about the parasite's potential linked to the symptoms.
Now let us look at the treatment. Any medication is only useful during acute toxoplasmosis in the dispersion stage of the germ. Cyst will resist chemical warfare. Not that the cat would need it, but occasionally the treatment of a cat shedding oocysts may help reduce the amount of infectious material excreted. Now what about pregnant women?
Infection happens during pregnancy. Toxoplasmosis dispersing in the body may reach the fetus as well as causing serious damage. The younger the fetus, the worse it can be. Well, if that's so, shouldn't the cat be kicked the hell out of here? No. Yes.
An expecting woman is not vulnerable unless her body encounters toxoplasmosis for the first time. During pregnancy, if she had the infection before, there's nothing to worry about. Furthermore, the cat is only a risk during the time it shares the germ, which lasts about 2 weeks. A toxoplasma cat in its entire life is only infectious for roughly 2 weeks. Soon, a pregnant woman has way more chance of acquiring toxoplasmosis from unwashed vegetables, fruit, uncooked meat, and contact with soil and neglecting to wash hands than from her own cat. What's more, a cyst needs about 4 days in the open to become infectious, so the risk can further be reduced by frequently cleaning and disinfecting litter boxes and by giving up the hobby of collecting excrement. It's time to toss this out. Spare Elvis, I beg you. A pregnant woman exposed to risks of infection due to lessened eat, washing the vegetables and fruit, cooking or frying the meat for a suitable length of time before eating, putting on gloves for gardening and washing the hands regularly. Cat litter must not be used for clay sculpturing. Best not touch it at all, and that's not to be poked at either.
The life cycle of Toxoplasma gondii, Part 1. Toxoplasmosis can be transmitted orally by blood transfusion, organ transplants, or from the mother to the fetus. When transmitted from the mother to the fetus by the placenta, Toxoplasma can cause extensive neurologic damage and even the death of the infant. Toxoplasma is infective to all warm-blooded animals, that includes birds and mammals. However, since the sexual reproduction of the parasite occurs only in felines, they are considered the definitive hosts. This mouse is infected with the Toxoplasma cysts. On preying it, the cat will also become infected. The infective parasites are inside the tissue cysts present mainly at the muscles and the brain of the animal. Usually, the cats get Toxoplasma at an early age. Only once after the first infection, the sexual cycle of the parasite takes place, resulting in the production of oocytes. As the tissue of the mouth are digested, so will be the cyst wall, liberating hundreds of bradyzoid forms that reside inside each tissue cyst. Once free in the digestive tube of the cat, the bradyzoids will penetrate epithelial cells of the intestine, especially in the terminal segment of the small intestine, the ileum. The intestinal walls are pleated, forming the villi. Underneath these villi, past blood vessels and nervous terminals. The apical portion of the intestinal epithelial cells have microvilli. This not only enhances the area of nutrient absorption, but also favors the invasion of the bradyzoids. Each bradyzoid will settle into the pericytophores vacuole and start to divide by schizogony. In this method of division, many nuclear divisions takes place, and in the end, the cytoplasm and organelles are equally distributed among the daughter cells called the merozoites. The merozoites have the host cell and invade new ones, repeating the process. After several schizonic cycles, gametogenesis takes place. Male gametes are called microgametes and are produced by schizogony but follow a different pathway, resulting to flagellated cells. Fertilization occurs when the microgamete fuses with the female macrogamete. Each macrogamete is differentiated from a single merozoites. It is not known if micro and microgametes are formed in meat in the same host cells as shown here, or if they are produced in different cells and the microgamete swims to find a macrogamete. The fact is that a huge number of oocytes is liberated during a short period of time.
Immature oocysts are eliminated in the cat feces. Once in the outside, the oocysts will mature and become very infective. People and animals can be contaminated by consuming raw vegetable of a garden or water sources contaminated with oocysts.
The life cycle of Toxoplasma gondii, Part 2. Thousands of oocysts of Toxoplasma gondii are formed in the intestine of cats and shed in the soil. The oocytes will become infective only after going through the process of sporulation. Sporulation is a series of division in which the number of chromosomes is reduced in half. The first division of oocytes gives rise to two sporocysts. Each is limited by a spore cyst wall, here shown in green. At the end of the process, the mature oocysts contain two sporocysts. Each sporocyst contains 4 elongated sporozoites. This is the mature oocyst, effective for any warm-blooded animal that ingests it, including people. The oocyst infection itself is also protected by a cyst wall that is resistant to the environment. When a cat evacuates close to a pasture or vegetable garden, this will become contaminated with oocyst. Moreover, the oocysts can contaminate and be carried by a water source. The oocysts are very resistant and during variation in temperature and humidity, remaining viable and effective for a long time. Animals grazing in this area will be contaminated with Toxoplasma. In the same way, people can acquire the parasite by eating food or drinking contaminated water with those oocytes.
While going through the digestive system, the cyst and spore cyst wall will be digested by enzyme of stomach and small intestine, liberating the spores. When infection takes place by the ingestion of raw or uncooked meat, the prime infection is made by bradysolite form. Both spores, white and reddish-white, will invade intestinal cells of the new host where they will divide, giving rise to tachyotes form that multiply quickly. From the intestine, the tachyotes will spread to the other cells and tissues, establishing the acute form of toxoplasmosis. During invasion, the chizoid of Toxoplasma gondii moves by gliding in the extracellular space, projecting this hollow cylindric structure, the conide, and secreting proteins from the micromines, here seen as yellow circles.
When a target cell is found as the macrophage, the tachyzoids adhere to it and start to secrete contents of the rhabdoids that we see here as the white bubbles. This modifies the properties of the plasma membrane of the host cells, which becomes receptive to invasion. During invasion, the toxoplasma is compressed, assuming the hourglass shape. Inside the host cell, it will remain inside a parasitophorous vacuole that protects it from lysosomal enzymes and from immune system of the host organism. Inside the vacuole, dense granules start to secrete its content, which will give origin to a tubular network and furthermore contribute to the growth of the vacuole as the tracheozoids replicate by endodiagon. During endodiagon, two daughter cells are formed inside mother cells. The mother cell keeps the apical complex until in the late process, while the nucleus and the other organelle duplicate and are distributed between the future daughter cells. Two new apical complexes and the inner pellicles form the two daughter cells, emerge, but remain linked to the residual body. After several endodiagonic cycles, the parasites are assembled as a rosette around the residual body that progressively accumulate acetylcalcism. Ultimately, the parasite detach from the residual body, break first the vacuole and then the plasma membrane, and move seeking for new host cells to invade. The cycle then repeats. Transported in the circulatory system, the caseworts spreads to the other tissue and organs of the host, such as muscles and the brains. Tissue cysts, as the immune system of the host is activated and start to respond to toxoplasma, will remain no longer inside the cell, such as neurons, and will start to convert into protozoites. The vacuum acquires a thick cyst wall and is now called a tissue cyst. These tissue cysts can remain unperceived for a long time, possibly the life of the host being characteristic of the chronic stage of toxoplasmosis. When present in animals such as cows or pigs, these cysts are also source of contamination to new hosts when their meat is consumed, raw or undercooked. The huge diversity of hosts and transmission pathway contribute to the global distribution of toxoplasma in the world.
To sum up, Toxoplasma is a parasite so common you can even find it where it is not. It has an intricate course of development. Only members of the cat family can be its definitive host, but it has more intermediate hosts than I would want to name. Humans are among them. Many are carriers, but since the infection is usually symptomless, treatment is rarely necessary. Pregnant women are vulnerable if they get infected during pregnancy for the first time. The family cat is as much to blame for causing fatal toxoplasmosis as the corrosion inhibitor and the padlock together. The poor thing is not to be clubbed to death with a spade. Please, if you want to make sure you can have yourself and your cat screened, it's just a few drops of blood drawn. Any medical personnel with hands can do it. I wish you good health and a pleasant delivery. Again, technical verification has been done by Dr. Eva Falk, veterinarian and expert in parasitology. I thank her very much.
That is all for now. A very big thank you for your focused attention during our video presentation. Your engagement means a lot to us and greatly enhances the impact of our message. We appreciate your time and interest in our work. Once again, thank you so much.
Okay. Head on the floor. Yes. No. Ew!
One of